Okay, let's try again. Well, hello everyone. Welcome back to Perfectly Holistic's show. We are back with Dr. Barrie Sands, and we're going to talk about energy, frequency, and vibration tonight. But our subtopic on this very important subject is how do you know when it's time to say goodbye to your pets? So, for those of you who are joining us, drop a little note over on this in the comments. Let us know that you're here and where you're watching from so we can say hello. And for all of the people on Instagram, give me just a second and let me go ahead and get that live going. Give it a second. Yep, here we go. Okay, so we should be good there. If you guys are watching on Instagram, just remember that we can't see your comments over there. So if you want to actually send in a question or a comment during the show, come over to our YouTube platform or our Facebook page and you can do it there. Dr. Barrie, how are you? And thank you for coming back. We have a great topic tonight. Do you want to introduce it a little bit? Get started on it?
Oh, yeah. Well, first of all, thanks you know, for me being here. I love it. I'm very excited about this. It's an important topic, and I'm feeling pretty good, pretty great
Yep.
actually. And the topic, it's sort of like a part two from our show that we had probably about a month ago, I think, maybe.
Mm-hmm.
And it is, how do you know when it's time to say goodbye to your pet? Right. That is a lot of the questions that I always get asked, and so probably you do too. And in the animal community, everyone always has that question: when do I know? How do I know it's time? And well, that's what we're here to talk about.
Yeah, absolutely. It is a part of the death and dying process that we felt like this was a really important topic to cover. And if you've ever owned a pet, even if you haven't dealt with this situation yet, you will eventually. So it's just nice to be prepared. You know, we're not going to try to make it all doom and gloom, but we want to just give you guys some insights. And I can't wait to hear what you have to say. I've learned a few things over the years, but I want to hear what you have to say first. So thank you. We've got Delph Blue over here watching from Canada. She says, we had to put my foster to sleep on Saturday, 35 days after a stroke-like event. We're not sure if a brain tumor or a stroke, but definitely it was kept losing weight and then difficulty eating. It was something neurological, and she felt helpless to stop the deterioration. Oh, I'm so sorry. It's so hard. It's so hard, especially when you see that they're suffering, and we want so badly just to turn it around, but that doesn't always happen. Yeah, I'm so sorry.
Yeah, yeah, that's definitely, dealing with life and death, or death in life, is always the challenge. So, I guess, why don't we just dive right in, to I don't know if a lot of people know, if you're new to this show or me, you probably don't know a lot about what I do. I work in the emergency critical care team. I have an integrative practice, and as a veterinarian, we are no strangers to death on any level. We spend a lot of our time euthanizing animals. I mean, that's part of our job. And so we interface with all different ways of that process. And one of the concepts, I think, and I don't know how quickly you want to dive like right in super deep, to the process, or, I mean, I could probably talk for about 30 minutes on this topic.
Well, Like, I guess what's one of like the most obvious things to look for? Like, you probably have a list of things that you kind of a checklist that you run through on some level to kind of figure out, oh yeah, maybe it's probably looking like it is, or no, there's still some life force there that's really good. So,
Yeah. Okay.
and being in the ER, you probably deal with traumas and you deal with sick pets too. So yeah, how do you handle that in the as a veterinarian? How do you consult people about this?
So, in the decision to say goodbye to your pet, there are moments where it's absolutely obvious
Mm-hmm.
when the animal is suffering, and you know that there is really no chance of survival no matter what you do. So, in those moments, it's a blessing to be able to, you know, help that animal transition to that non physical realm. The word euthanasia actually breaks itself down to EU, meaning good, and um, Thanos, meaning death. So it actually means good death,
Mm,
right? And so our goals in this process is to really escort these life and these souls into another realm.
mm,
And the the difficulty in when to decide when the right time is for your pet to let them go has very many factors and many layers. You have to take into account everything, you know, your family, your situation in the family, your the health and well-being of your pet, and then within that there's layers of what is the criteria that we look for to see if they want to live anymore,
mhm,
you know? Whether or not they are in pain, and you can't get them out of that, whether or not they are anxious and you can't get them out of that. You know, in hospice care or palliative care is usually where they make that decision of when to let go. And, you know, sometimes it's around whether or not the animal wants to eat. You know, if you
mhm,
have an animal that is loves food, and that is that their litmus test, and they just decide that no, I don't want to eat, and you may get that sense that it's time, and that animal is kind of given up and is ready to go, right? And um, the decision, I feel, is ultimately based upon, or I should say this, I should say the comfort level around the decision that you make is ultimately based upon your understanding and your viewpoint of what death really means, and,
mhm.
and the process of dying, right? And your attachment to that. And I think ultimately that's what makes it so hard for a lot of people,
Yeah.
because you know, for a lot, death is a very final thing. It's a scary thing. It's an unknown. And if you knew, if someone said to you, would your animal in front of you, you know, I just had a conversation with your dog, and I had a conversation with your dog's higher soul and his spirit. And he says, you know what? He's ready to go home. He's done. His body is tired,
Yeah.
and he's ready to transition, and he's going to a really good place, you know.
Mhm.
And if you need him, he'll be around.
Yeah.
You know, if people heard that, a lot of people would feel so much comfort,
Mhm.
you know, and they want to know that if they do hear that, that's a truth, and that's not something imaginary that they're just making up. And
Agreed. Yeah, I always encourage people to use animal communication when they're kind of leaning toward that time, or if they see their pet really declining, to go ahead and talk with them and get their insight. Ask them how they want to be remembered, or how do they want to live out the rest of their days, or how do they want us to celebrate their transition, and how does that look to them, and what, you know what I'm saying? It's just because some pets are very specific. They're like, I want a certain pillow, and I want you to light a candle, and I want you to sing a song, and or whatever it might be. They can have a very strong opinion or ideas of how they want us to view their departure, and I don't think they want us to feel sad. I think they want us to feel not necessarily happy, but like you said, look at it from a different perspective. They're just changing forms, because in truth, we know we don't ever die. We just change form,
Right, right. And that's also a very, you might intellectually know that, but your heart is breaking.
Absolutely.
And the reason why it's breaking is because there's a piece of you that's going with that animal. It's that deep unconditional bond, that unconditional love that starts from the moment your eyes meet to the to the day that their heart stops. Because when their heart stops, our heart breaks. And I feel when people say, well, there's a common phrase like, well, you'll know when it's time. You'll know when it's time. I don't know how many people actually get comfort in that statement, because I feel that gives a lot of people anxiety when you say that, because they don't know, like, well, how am I going to know? What am I going to feel? And how am I going to know that? And so for me, I think one of the ways that you can tap into your intuition and your animal's intuition is go into ceremony. And what I mean by that is take a moment, in a quiet space with you and your pet, when you're at this junction or this crossroad, and maybe light a candle, put on some music in the back, have everything kind of dim. You can use, if you like certain instruments, you can do drumming, you can do rattling. If you have a rain stick, or whatever is kind of soothing, cool little instrument you might have, use that and start to just breathe and breathe for a minute or two, slowly. And your intention is to tap in to your animal's space and be open to whatever comes, whatever imagery, whatever feelings, whatever smells, whatever sounds just come into your field. And just ask the question, are you ready? How do you feel? And just whatever comes to you in those moments. Usually the most quick answers that come are the answers that you're meant to hear, without second guessing or thinking about it, and use those moments, and then you'll know.
Yes. And I've also had certain clients, when they did the animal communication sessions, they asked their pet, give me a sign when it's time and you're ready. And they do. And if they remember it, it's like, don't forget, but this is the sign. And they will tell you if we're willing to ask, because it's kind of a scary question, right? Because it's like, oh, I almost don't want to know the truth. The hardest part, I think, is because we like the physicality of being able to hold them and smell their fur and hear their purr or hear their bark or whatever it is. And we just like that contact, and their departure ends that contact from the human contact that we get so much fulfillment in our heart with,
Absolutely. And I mean, that's why it's important to, I like to say, live well and die consciously. Right. So treat every day like a gift and a blessing. Don't wait till the diagnosis of cancer or some terminal perceived condition to start living, and to start being grateful for the moments and laughing at the mishaps and and, giving your cat a bowl of ice cream, and, it's okay. Like, just live in the moment. Each moment is precious. Like, I think Albert Einstein said that you can live each moment as if it was a miracle, or if nothing was a miracle.
Yeah.
And if everything is a miracle all the time, well, then you're in this constant state of love and awe. And then when the time comes, there's no regret, right? There's no feeling guilty. Oh, I wish I would have, I should have, I could have.
Yeah.
Right. It's always, I wish I would have done enough, and there's levels of timing where people have said, I wish I didn't wait that long. I think sometimes that's one of their bigger regrets, is that I wish I would have done it sooner, because they held on, and then they noticed that there were moments where they thought or perceived that animal was really suffering. And they were like, oh, he shouldn't have suffered those last moments like that. It should have been more peaceful.
Yeah. That's true. And I also feel that, like, hold on. The thought just went through my head when you were talking. Like waiting, it was around waiting too long. I'll come back to it. I'll remember it in a second. Keep talking.
Yeah. Well, and then there's those moments where there's an unexpected situation, right? Like what I was talking to you about before was more about hospice care, palliative care, and then a planned transition or euthanasia. Then there are moments where things are unexpected. The animal's in crisis. Like, they're fine, then they're not.
Yeah.
1 minute they look great, and the other minute that they're not. And then you have to make that decision acutely. And, what usually base that on the recommendations of the veterinarian, because you're probably in a situation where you're in an emergency room or, in that place. And, and then you're asked to make that decision, and then sometimes the decision is made for you, by the animal. They'll just check out on their own. And I've had that many times. I've had 2 cases I'll actually share.
Yeah.
One was a cat. And, for me, I think the worst thing that cats can do is when they have what we call saddle thrombus, where they have a blood clot that gets lodged into the distal aorta, and they lose blood flow to their back legs.
Okay. Yep.
And, if people aren't unaware of that in their animals, and hopefully you never will experience this, but it's usually secondary to some underlying silent heart disease, and they're fine. They're absolutely fine. And then they're not. All of a sudden they're meowing. They seem in distress. They can't walk, and their feet are cold, right? And so they come to the hospital, and usually by that time they might be in heart failure, and it's terrible, because the chance of recovery from that is very, very small. Like maybe 3 to 5% of those cats will come back after extensive workups, and that you're really not finding a good cause of the problem, and there's some blood flow, and it's complicated. But with the majority of these cats, they are euthanized then. And I had a client who this happened to, and he had a beautiful 3-year-old Maine Coon, and the cat was in distress, and the cat was in the oxygen, and we gave it some treatments and pain medications and things to alleviate the acute crisis. Then I'm talking to the owner, and he's beside himself. He doesn't. This is not expected. The cat was perfect the moment before, and he cannot come to terms or grips or wrap his head around not having this cat in his life. And as we were talking, I said, well, let me go back and take a look at the cat and see, check on and see how it's going. And I was back there for, maybe a few minutes, and then the cat died. She just died. And it was quick. It wasn't like this cat was suffering or flailing or anything like that. It was like she just died. She took a breath, and then it was over. And I went to the room with the guy and to tell him that she passed on her own. And he was so incredibly relieved that it happened because she made that decision for him. She made it easy for him. And I think that there's moments our animals know that. They know when we struggle with a decision and we can't get out of our hearts and our minds and our this and our that. And then they do it for us.
Yes. That's what I was trying to think of earlier. I was like, I have never had a cat be able to pass on its own. I really wish I did, because I don't like making that decision. I don't think anybody likes making that decision. But it's interesting how some pets will choose to do that on their own terms when they're ready or when they need to go. And it's interesting how other pets just need help crossing over, and I don't know if some of that is because there's such an attachment that they're trying to stay here for us on some level, or maybe I don't know why. Well, what are your thoughts on that?
Yeah, well, I think that in order for the body is so resilient and so strong that it takes a long time to get to a point of physiological deterioration before it's over. Like you might have a cat who's 19 years old, really skinny, and then has some sort of low-grade chronic inflammatory disease. Maybe it's kidney, maybe it's pancreatitis, maybe it's bone marrow, maybe it's cancer, I don't know. And the cat stops eating, and then he doesn't eat for like 4, 5, 6 days, and you're kind of watching him, and then they die, right? So it's like a process. It's a long process. So and should you wait for that process? I don't know. I mean, you have to ask yourself, is my cat in pain? Is he suffering?
Yeah.
And that some people, it's part of their philosophical religious beliefs that euthanasia is not something that they want to do.
That's true.
So the animal, you'll have to wait, until they die. And hopefully it's one of those kind of, I'm just kind of falling asleep and I'm sick and I'm weak and I'm dying, from that exhaustion process, as opposed to, I can't breathe and I have asthma and I'm gasping for air, and then you're watching me die. Right? Because what's the point of that? We really want to help them. There's no reason. We have ability to help them through that moment, so why not take it?
Yeah, absolutely. Have you heard of the acronym BEAM, BEAM? No? Okay, this is a really interesting. I love this. And this is something that I tell people all the time when they ask me, how do I know? Okay, it's BEAM stands for behavior, energy, appetite, and mood. And so you can kind of rank on a scale of 1 to 10 what your pet's BEAM is. What's their behavior today? What's their energy like? What's their appetite like? What's their mood like? And, a healthy pet, it would be like 9, 10 all the time. But as they get into this stage of hospice and things like that, you can, if you're really paying attention and you've been noting everything, if you start to notice that it's like 1, 2, 1, that's definitely a simple way to kind of gauge when that pet, they're on the last stage. And so, I just found that to be very, very helpful, because if you have a cat who has, their behavior is completely normal, but their appetite is like way down, but they still seem to be, in a semi pretty good mood, but they just have low energy. Well, that's like a 5 and a 5 and a 9 and a 9 or something like that. So it's like, no, no, I don't think that doesn't make me think that they're ready to go. That is, something else is off. You might be able to fix something, or buy time, or whatever it is. But I wanted to share that acronym. It's BEAM: behavior, energy, appetite, and mood. And when they're all low, that's your sign. You know, if you've
Yeah.
got some that are high, it's like, no, no, no. They all need to be way at the bottom, and then you'll it's just a good indicator.
Yeah. And then you have to also take into account the ultimate quality of life,
Yes.
and like it's very individual, it's very different. And sometimes when we have these lists and these checklists to go through, I feel it takes us out of our heart and more in our head, and then we can even get more anxiety around that, because
Mhm.
we're constantly saying, okay, well, you're on this day, you're out of 1 out of 10 you're this, and then you're 1 out of 10 you're this, and then you're just focusing on that instead of really just being in the moment and enjoying the time that you have. Because honestly, it, if it's between 1 day or 3 days, there's not much difference in that time frame.
Right.
Like, I know people that wait for family members to come, like they're trying to all be together, right? So
Mhm.
there's a reason why you want to wait for the kids to come out from school, or something like that.
Yeah.
Like you're in college or someone's traveling, they wait. But if it's really just a matter of, well, I'm just going to watch you not eat for one more day, and then we're going to do it, there's no point in that, in the time frame, because you're asking yourself, well, who am I doing this for? Am I
Mhm.
keeping you alive for me, or is it for you? And if the animal is sick, seek medical care to see if there's something that you can do.
Yeah.
I've had many people bring their animals, really sick animals, into the hospital, and they're like, well, I don't know. He hasn't been eating for a while. He's really sick. And I don't know if it's time. And I'm like, well, let's do some diagnostics and see, because there might be something that we can do to treat and mitigate and make better.
Right.
Right. But then the person says, well, I don't want to do that. I don't either. They're not emotionally ready. They're not financially ready. There's a lot of backstory to the decisions people make,
Mhm.
you know?
Mhm.
And so then there's counseling that I have around that, like if your animal's super sick and you have no means or desire to even look into what is happening, and it may be a simple fix. It
Yeah.
may be something that I can absolutely help with, but it's going to take some time and effort on your part. And if you're not invested in that, ultimately this is your animal. This is your pet, your life, your love. And don't let them suffer that way. If the decision is not to treat or to diagnose, then it may be time to do that.
Mhm.
This.
Okay. Yeah. Did you want to share a second story?
Oh yeah. This is a dog story. And this is, it's unique, but it's not unique. That we were talking about how sometimes animals will make their own decisions to
Mhm.
go. And I had a dog that came in, and he had trouble breathing. He was panting a lot, and he had cancer. And mom was out of town, and the mom's friend was watching the dog. And the dog seemed fine when she left, and she was only gone for a couple of days when the dog started to go downhill.
Mm.
And it seemed like he was coming out of remission and the cancer was sort of coming back. But mom, would spend anything on this dog. So her friend brought the dog to the ER. We did a bunch of diagnostics, and we found like, yeah, that his cancer is back. He's out of remission and it's bad. It's really, and there wasn't much that I feel like we could have done, for him to help him.
Right.
And the dog was, we had phone calls with the mom, and she was like, well, I can't get back for for a couple of days. Can you please just do what you can until I get there? And we were like, okay, so we did all sorts of things. We gave him plasma transfusions and blood transfusions and oxygen and medications and, all sorts of things. And he did get better. He became a lot more stable. But yet he was still breathing fast. He's still always going to maintain this sort of panting state. And we couldn't figure out why. Like, why is this dog still? There was no physiological reason for this to happen. Like, he wasn't anxious or stressed or painful or in shock. Like, I couldn't figure it out. Like, what was this about? So then mom came back in town, and the pet sitter came back first to visit in the oxygen tank. And the dog was, saw the pet sitter and was still panting. And then mom shows up. A few minutes later, mom shows up, and she got a chance to see her dog, and her dog was happy to see her. And he was still breathing hard, but maybe a little bit less hard when she showed up. And then I had a conversation with mom, and we were going to, talk more about like, okay, what's the process now? We probably, we'll put him to sleep. And now that you guys are together, and she went in I was escorting her out to go into a room so that we can talk more privately. And within, I'd say maybe 20 seconds, her dog just stopped breathing. And I was called back to the treatment room, and that was the end of that. And then I got mom back, and she came back to her pet, and he just stopped. He stopped breathing, and he made that decision for her, and he waited for her. Absolutely waited for her to come so that they can connect, and that he could go. And I think that his panting and the way he was breathing was, in my assessment, was just his way of just trying to hang on, hanging on by his breaths to keep his spirit in his body until mom got there. And then it was actually quite beautiful and very, very peaceful. And everyone cried, but it was joy. It was joyous tears.
Yeah.
Because she knew that he was suffering. She knew that it was time. And, it was just beautiful. It really was.
I have such a tender heart. I don't know how vets handle that. I would be a total slobbering mess.
Yeah.
I don't know how you do it. My hat's off to you, because I just can't. I walk, you like some vet clinics, they'll have like a candle burning, and they'll have a little sign on their front desk that says, please be quiet, because there's a pet that's gonna transition or whatever, something to that effect on the desk. And if I see that, I just start crying. I don't even know this animal. I don't know the people. I just feel that that sadness, I just sense it. Oh my God. I want to cry right now.
Well, yeah, and that goes back to our feelings about death and dying, and life. If life is a circle, then there's no beginning and no end. It's just a moment in time that passes. And there's I consider myself, ultimately, there's an archetype. It's called a psychopomp. I don't know if you've heard of a psychopomp. And a psychopomp is this ancient word for a person who guides spirits.
Okay.
from life to death, right? Or death, or from death to life. Like it's like a transition, or
Yeah.
even through transitions in life, um, as we move through our own psyche and our own healing, there's always moments where part of us will die so that part of us can get reborn.
Mm-hmm.
There's this transition of energy, and I've always been that. I've always been that person.
Interesting.
Since a young child, I've had a very unique relationship with death, an understanding of that, through my own near-death experience when I was a child.
Mm-hmm.
I'm not gonna. This is not the time to talk about that, but however, that did show me that there is nothing to be afraid of, uh,
Mm-hmm.
in life or in death. And it's really about living well and dying consciously. And dying consciously means there is an awareness and a choice and an understanding of moving into this new spiritual realm. And it's okay to have your heart break. It's okay
Yes.
to lose the ones you love, and to honor that, and go and grieve, go through that grieving process. That's
Absolutely.
important, but you don't want to have regrets,
Yeah.
um, and guilt. That is not an emotion that your animal, or even a loved one, a human loved one, ever wants the person that has survived to feel,
Right.
ever.
I
So
agree. And the pets in spirit that talk to the animal communicators, and even mine, they've said that over and over and over again. You know, it was my time. It wasn't your fault. Don't hold any guilt and let go of all of that. It's not, that is nothing to do with what happened. You know what I mean? So they say it. They don't want us to be suffering due to their loss. They don't want us to feel guilty. They expect us to, that we're sad. We understand that, but they don't want us to wallow in it and to get stuck there. You know,
right,
process it, but then celebrate them, you know, and just take as much time as you need to heal, but don't get stuck in it for years and years. I have actually talked to people who lost a pet long time ago, and they still, just the very mention of their name, and they cry.
yeah,
You know, it's like there's still some attachment of guilt or something that they have not processed through, because at some point you have to move past that.
yeah,
Um, you know what I mean? It's just, you can get really stuck in it, and it's not a good place to be, because you've got to move on with your life too. You know, even if it's a family member, they don't
right,
want you to be stuck in this one spot and, put your life on hold and not enjoy things and not go do things and not, you know what I'm saying? That's not how they would want us to live, whether it's a pet or a family member, you know?
right. And one of the things that we could do, um, with our animal, is in ceremony, is to ask the question, how write down in a journal, how am I feeling?
Mhm.
Um, what are the gifts that you have given me? What are the reflections that you've shown me? How do I see myself in you?
Mhm.
And what is it that I'm truly afraid of losing?
Those are
Right?
good questions.
Because it's always, an opportunity for growth. Everything our animals do for us in our lives is always an opportunity for us to grow,
Yeah.
spiritually, emotionally, mentally. And
Mhm.
so what is the overarching message here?
Yeah.
You because there's always something beautiful about them and us that can be revealed in those moments.
Mhm.
And then it's sad, but it should be peaceful,
Yeah,
right?
I agree. And the other thing that I don't think people realize is when their pets transition, they're going to still hang around for a little while.
Mm-hmm.
I mean, they just do. It's like there's a, what do you call it, like a transition phase that they have to adjustment. And
Yeah,
I
and I
know
think
I've just I even my own pets, I know they're still around even after they pass, like, especially immediately if it's in my home or whatever, they're just around. They're just kind of,
yeah,
whatever, probably looking down on me going, "Oh, that's a nice little bed you made me," or whatever it is, They're just like, "Hey, I'm still here. I still see you,"
yeah,
Um,
yeah. And
and
and I
then
think it also depends. I think it depends on the animal too, because
yeah,
there's some that will just go.
yeah,
They're they're gone.
yeah.
You know?
It depends on
And
the connection and what their
yeah,
purpose is, and if they have another, "Sorry, guys, I gotta go. I have another job to do on the other side." They're just it depends. You're right.
yeah. And it also depends on how they went. Sometimes if it's traumatic, you know,
Mhm.
versus like, your cat goes outside and gets hit by a car
Yeah.
or by a coyote or something that was acute and traumatic. Sometimes they will hang around just like people,
Mhm.
because
Mhm.
there's this moment of like, what
Wait,
just
what
happened?
happened? Yeah.
Did I
Yeah.
just die? Like, am I really here? Am I not here? Like, you know.
Mhm. Mhm.
And
Exactly.
there, and so I've actually gone to people's homes to help, release these spirits or these souls that just feel kind of wayward and stuck
Yeah.
in the process. And so they really need to go. I mean, for the most part, I mean, we like it when our animals hang around, you know,
Mhm.
but for humans, it's better if they move on, you know.
Mhm. Yeah.
It's just this kind of weird vibes that you get. And there's always those, visitations and dreams. Use your dream time for
Mm.
connect, because that is one of the times where it's the easiest to connect with them. And also too, it's interesting that we're talking about this because we're coming into October and Halloween and
Mhm.
All Hallows Eve, which in the Celtic tradition called Samhain is the time where the veils between the realms are
Oh,
the thinnest.
yes. Yes.
So if you are going to try to communicate, with an animal or a person, now's the best time to do it. It's the easiest.
Can you explain to people a little bit more when you say try to connect with them in their dreams? How would you do that? Like, how would you tell or instruct?
So the way I would do it is before you fall asleep, set an intention that you want to meet with your beloved pet. You can even imagine a place in
Mm.
your mind, like in a vision. Using your imagination is always the best way that we communicate with our animals in life and in death, right? Imagery. And
Mhm.
imagine a garden or a beautiful place, either on a mountaintop or by a stream or by the beach or on a path in the woods, like some beautiful place, and is a sacred place for you to go when you want to communicate with your animal. And you can go there um, in your beautiful little garden or seaside or
Yeah.
mountain or place, and 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 ask and say, this is our place for us to meet. And
Mm.
and you can even imagine your pet being there. Just imagine them sitting next to you on the rock or the bench or the
Mhm.
by the stream, and then have a conversation and ask them, how are you? Is there anything you'd like me to know? Is there
Mhm.
anything I need to know? Do you have a message for me?
Yeah.
And then they will, and then just see what you get. And then if you take that into your dream time, you might just have an experience like a dream or a
Mhm.
visionary dream or a lucid dream where you're doing something with your animal, that's profound and beautiful. And then you're like, oh, because, when you're in those moments of lucid dreaming or in these dreams, your your body doesn't know the difference between where it's happening.
Mhm.
feels the same way.
Yeah.
And there can be a lot of completion and heartwarming and, just beautiful, beautiful experiences in that realm.
Yes, it is fabulous. I've actually done some meditations that are kind of similar to that were guided, that where I connected with Snow Bear, who was my inspiration for my company. And it was just so fascinating because I kept redoing that same type of meditation after the class that I took when we did all that. But I kept repeating and going back and, just on my own, connecting again. And it's so interesting just how it almost feels so real, even if it's in a meditation. I could see him, I could feel him, I just knew he was there, and sitting down. It's so funny, sitting down on a rock watching a stream. And he climbs up in my lap, and I'm like, what do you want to know? What do you want to tell me? And those are the most profound experiences, and the messages that come through are so pure and they are so spot on. It's not like you're trying to make things up. It's literally downloads of information that just kind of pop into your mind and you're like, wow. And then you better go write it down because you won't remember. Write it all down, every little detail that you can remember, write it down when you're done. And then just go back and read that when you need encouragement, or you're feeling sad or want to connect with them. It is so powerful. It is so powerful. Absolutely. Does anybody have any questions? I mean, we're happy to take questions tonight. Janae says, I'm the same way, Pam. With that being said, I need to sign off. It brings back sadness when I put my other two cats to sleep. So thank you, ladies, and see you next time. I understand. Absolutely. Yeah. So if anybody has any questions, definitely drop them in the comments. We are happy to share and give our insights and ideas for you, for sure. How many pets have you lost, Dr. Sands?
I had 3 or 4 cats and a dog and 3 cats. And one of my cats, we had and they were all beautiful. They all lived to their ancientness.
Yeah, that's awesome.
They were all in their mid-20s, actually.
Oh,
and
wow.
They were so old and they were so ready.
Yeah, by that age.
They were, and it was beautiful. And I did put them to sleep in my own backyard. And in their in this spot that they loved, in the sun, and it was very ceremonious, and and they were really, really ready.
Yeah.
And it was beautiful, and the burials were just as beautiful and ceremonious because we buried them in the backyard as well. Yeah,
that's awesome.
We had a burial on one of our cats that we had another cat that attended that. They were friends. And we were standing around the grave, and we had his little head sticking out so that we could, I don't know, have ceremony. And when we all had something to say about how much we love and honor their life, as we were leaving the cat, we forgot that the cat was present. And we were walking away we were like, okay, we're done. And then the cat was just standing there by the side of the grave, of the hole.
Yeah.
And we were like, oh, wait, we should probably go back because, Queso wants to say something. We didn't give him an opportunity. And so we all came back and held space for Queso in this moment. And he went, to the face of the other cat, did a little, I don't know, telepathic sniffing or something. And then he turned around and he just put a bunch of dirt over his head and like was just burying him himself.
Oh my gosh.
And it was so beautiful. It was miraculous and beautiful that he did that.
Wow.
And
That is-
it was the closure that he needed, you
yeah.
know?
Yeah. Delph Blue has a question. She says, if an animal is put to sleep at a clinic, do they follow you home, or is the energy there just from before they went to the clinic? Do they find their way home?
So the answer to that is yes, because there is no, you think about that from a very limited three-dimensional mindset, and
Mhm.
there really is no boundaries in time space.
Yeah.
There's no time, there's no space. So they're kind of everywhere and nowhere at the same time, and they're with you. It's your
Mhm.
energy, and so
Mhm.
they will be there. It's like when you think of angels, right? There's I don't know, like Archangel Michael.
Yeah.
And a lot of people know Archangel Michael. He's a big protector. He has a sword, and
Mhm.
and so there's this. You think about this one archangel, and if you know millions of people are asking for Archangel Michael's help, how is it that this one angel can be helping everybody at the same time in their own specific ways, right?
Yeah.
Right. And there's not that there's millions of him or it or
Mhm.
this entity, this energy. It's just this one thing. And it's just this one thing is this big thing that's in everything.
Yeah.
Because when you become the one, you become the all. And it's just the different frequencies that you can sort of pull into and resonate
Mhm.
with. So your cat has a frequency that matches yours for a lot of the time,
Yeah.
and there's a resonance around that, and they will be with you in
Mhm.
their home, in their space, in their environment. So it doesn't matter where it happens.
Right. They will
Yeah.
always be with you. Christina says, let me put this on the screen. Hold on. She says, hold on, it's a little slow. I have a 14-year-old Turkish Angora who is mentally ill with depression and anxiety. He is a sweet, cuddly boy at home, but a terrified Cujo at the vet. I would never want the vet to be his last experience when it comes time. I'm the only person who can touch him. I think you should do in-home
Mhm.
service for sure. It's actually it's very beautiful. Save up your money. It's not cheap. Unfortunately, house calls cost more money, but you can create the environment that you want. He can be in a loving space, in a space that he knows, with people that he knows, or with other pets or family members there. You can put on calming music. You could dim the lights. You could light candles. You could make it however you want it to be. Um,
Yeah, I've done a lot of at-home euthanasias, especially for my holistic clients. I will do that, and it's beautiful and it's ceremonious, and there's prayers, and I do shamanic death rites, with them, and I'll do whatever the people resonate with and want. A lot of them do want that. A lot of them want the ceremony and the prayers and the candles and the crystals and that whole thing, the energetic releasing of that. So, and then some people just they don't want that. They want something
mhm.
just more simple, and it's whatever experience you want, and that's comfortable, and it's always beautiful, and it's always great, and the animals really, they like it. They like being in their own home.
Yeah,
you know
absolutely. Totally
A-
less stressful for sure.
yeah, and then for some people, they don't want it in their home. They don't want that memory of that
Mhm.
situation in that room, in that place, in that time, in that way, right? So they want to be removed from that. So it's very individual.
Yeah, that's
you know
true.
and if this particular cat is a Cujo at the vet, and it's something that you really want to have happen in a veterinary setting, you can always get sedatives and medications that you can give them at home before they get there. So they're not like that.
Yeah. We have another question from Laura. She says, my pug passed in 2023. I have another pug who was 2.5 at the time, didn't eat well and was throwing up. Now, almost a year later, she is eating and fine again. How can we support living pets through grief? That's a great question. I use homeopathy and color therapy. What do you do, Barrie?
Well, for one thing, I think it's important that I think it's helpful that the animal that is living with, the other animals, understand that that's happening in the first place. I find the ones that seems to struggle with the grief are those that, their buddy left and didn't come home,
Yeah.
and they didn't know why, and they're waiting at the door for them.
Mm-hmm.
I've had that. I've seen that where they seem brokenhearted.
Mm-hmm.
I think it's because they just didn't know. They
Yeah.
just didn't know, and they weren't informed. And so sometimes having the other animal there present during the process is important. Or if that's not possible, then to have the conversation. Be open with them and talk to them and let them know that this is what's going to happen.
Mm-hmm.
And so I don't know. I think that's probably why most of them will grieve, is because they just weren't aware and they felt out of the loop,
Mm-hmm.
perhaps the decision making process.
She was present when it was done at home.
Yeah.
I had that happen. Yeah.
Yeah. I'd say to have the conversation, have a conversation and hold space for her grief.
Mm-hmm.
And, and things, like flower essences.
Yes. Gorse. Gorse is a great flower essence for grief.
Yeah.
Ignatia is a really good homeopathic remedy for grief. Color like yellow can help brighten depression and bring more cheerfulness into the energy, into the environment. So you could do a combination of things. Rose quartz crystal is also very healing for the emotional heart. So whether you want to place a rose quartz crystal next to the pet or like brush them with the rose quartz crystal, you could do that too. I had a pair of twins, Gunner and Rocket, and Aylin was the baby who's 7 years younger than them, but she bonded to them like nobody's business when she moved in. And when Rocket passed, I mean, Gunner and Rocket were bonded twins. They were so similar, separate, walked the same, laid down the same, talked the same. They were like mirror images of each other. And when Rocket passed, he was at home and all the cats were there. But I'll tell you what, I have never seen cats grieve. Those two cats, Gunner and Aylin, they grieved for 2 weeks. 2 weeks. I have never seen that. And I did eventually use some homeopathy with them. But it was so incredible to watch them go through that process. I did not expect that, honestly, because I've never witnessed that, but they were so bonded, the 3 of them. It was like a third wheel let fall off.
Yeah, I guess my question to you, Pam, around that is, for you, how was your grieving process, around that? And was there any way that there's some, mirroring for them in you?
He was the second to the last one, just 2 cats ago. And I was in a totally different mindset by then in terms of the whole death and dying process, because I had learned so much from previous years. So I was in a much better space.
Mm-hmm.
I think my husband at the time was really taking it hard, because some men he was very, even though he wasn't super like bonded to them like I was, his love for the cats was very deep. And I think he was really taking it hard because he couldn't fix it,
Mm-hmm.
he couldn't change it. So, and he was home a lot during that time period. So his energy was all there. You know what I mean? And I was going to work every day. So that could have been part of it. Um, but yeah, it was kind of shocking that they were just so out of it for a while. I think I actually did pretty well through that one, despite the fact that it was not it wasn't the outcome I was expecting it to be.
Yeah.
We were given like he had about a 4 week window to live by the time we got his cancer diagnosis.
And so, I always feel like, grief is a process.
Yeah.
And every animal, every human grieves differently. And to hold space and respect that and to honor that in a real way, where
Mhm.
maybe the animals that are left grieving, they
Yeah.
need ceremony. They need a process.
Mhm.
They need an honoring process and say, okay, look, with this little dog, let's sit down and let's light a candle and let's say a prayer and let's, do this.
Yeah.
And, because energetically things are going to shift when you shift that. And that could certainly help. And then, adding all those other beautiful things, like even
Mhm.
rose water, rose quartz, rose water, rose
Yeah.
mist, the smells, lavenders,
Mhm.
things like, and citrusy things like lang lang, lavender,
Yeah.
um, those beautiful, those uplifting sort of smells. I mean, animals are very smelly, They're-
Very, yes, they are very strong sense of smells, don't they?
yeah,
Yeah. Yeah, I have learned so much since the last cat who passed, and that was almost 3 years ago. So, not that I expect it to happen anytime soon. Touch
yeah,
wood. Um, but there's more that I will do next time that I have learned about. So I think every time it comes around again, it's another opportunity to just apply something else that you've learned along the way, along the path. And hopefully we've given you guys a lot of ideas and perspectives to think about, and just follow your heart, right, Dr. Barrie? Just follow your intuition, let it guide you.
yeah. And it. Uh, I help people in those decision making processes. So if they do need some other, deeper wisdom, or they need an
Mhm.
outside viewpoint on that, they can always, go onto my website. I do telemedicine consults.
Yeah.
We can talk about that, and we could do ceremony. I
Yeah.
could do remote ceremonies, and for those
Oh.
that have already passed and they need some help, or I mean, I obviously can't go there and put them to sleep, but it can be, a pre-blessing around that. And,
Oh, I
you
love
know,
that. I'm calling you next time. We'll
yeah,
definitely do that. Oh, this has been great. Well, I want to be respectful of everybody's time. We so appreciate you guys being here. Please
yes,
share
thanks.
this. Please share this video, like it, put that positive affirmation wherever platform you're watching on, and share this with someone who you feel would really benefit from it. Any final thoughts, Dr. Sands, before we wrap up?
Just live each day with joy in case it was your last, and not with sorrow in
Hmm.
case it was not.
I love
And
that. Very wise words. Very wise words. Okay. Well, until next time, thank you guys for being here. Thank you, Dr. Sands. Love you so
thank
much.
you.
And we will see you guys next time. Y'all have a great evening.